I have bilateral osteoarthritis of both knees. I was first diagnosed in the fall of 2016 after I discovered a limp that summer, and it was bone on the right knee right away, and the left started compensating, so they both kind of went and gave me a lot of pain to deal with. I first discovered the limp when I was out shopping. You know, what I used to be able to do for hours, I could only do for maybe 30 minutes. I had to take constant breaks to sit down, catch my breath, let my knees rest, let the pain subside. The doctor at the time did tell me that I had knees of an 80-year-old and that I would need surgery by the time I was 40. And that was disheartening, to say the least, so it was hard to deal with. I started cortisone injections pretty much right away. It did work. At first, I got relief for maybe 8 weeks, so about 2 months. Before I started SoftWave, it was cortisone injection in each knee every 3 months for probably 4 years solid. When I was limited, I was not able to walk even CVS, Walgreens, a grocery store. I was limited to standing less than 5 minutes. Now I can do those things again without being in pain. Doing my treatments here have helped me save the mobility that I had left and gave me hope that we would actually grow some of that soft tissue cartilage back in the knee. I love Dr. Nathan's team. So from the very beginning, the whole team, and I'm not talking one individual, I'm talking the whole team, will greet you by name within the first week. And that's very impressive considering the practice that they have and how many people that they treat and see every single day. I love you guys.